Hi, I'm David Tollerfield, and this is part two, Seeking Help, after you've tried the self-treatment at home. I hope you'll find that this series will bring information to you that you may not be able to glean from other sources. As a former podiatric surgeon and as a patient who's had treatment for Mortons neuroma, that was 9 years ago, I'm best placed, I feel, to give you some accurate information. So you've already tried as much as you possibly can. So now we need to seek help, and you need to go to a professional for that. Professional podiatrist is probably one of the best people to start with. And what we're trying to do is to avoid surgery if at all possible. It won't be the case for everyone, but we obviously need to aim to do this. So symptoms are progressing now. You need clinical treatment, and we need to decide whether it's necessary to have surgery. Along the way, I'm going to try and give you some indications as to why certain treatments are valuable and why some perhaps are less successful. Now, we've all experienced pain. It's different from different people, different races, and also the genders. The type of pain that we're going to experience also includes a number of sensations. So we might have tingling in the toes due to the alteration of the nerve supply. There's scarring around the nerve at this point now, and this is why things aren't getting better. We'll find that the level of pain, certainly once it reaches around 4 to 5, certainly requires help. So if you've got an idea of where your pain level lies, but more than that, it also includes the fact that you may put certain shoes on. You may find that at work or undertaking just simple walking as a hobby, or at worst it may affect you at night. These are indications certainly for you to seek help. So if we look at what I like to call as a timeline, we find that there's absolutely no specific timeline. If you look at A and B to the left, where we've done self-help, the A part of it has absolutely no timeline. We don't know how long it's been there for because symptoms creep up very, very slowly. The objective is to identify even the earliest symptoms. It may be discomfort in certain shoes. It may be a stone that you feel is trapped in the shoe and there is no stone there, or it's tingling at the end of the toe. You may get cramping sensations. You may get throbbing. Burning is another indication that it is a nerve problem. We've looked at tests in the first part. I'm not going to go through those again, so do have a look back to see those tests, but your clinicians will obviously look at these tests in order to identify the potential for a neuroma. Now, a neuroma may very well be part of metatarsalgia, so it's not always a neuroma. It may be something else that's present, and that's why you need to have a differential diagnosis, one that might elucidate another condition which needs to be treated. Ultrasound is the go-to. It's relatively inexpensive to perform. It's accurate. It's a good 90% plus accurate. It will tell us the size of that lesion that we actually see there. So what do we see when we go for an ultrasound? Well, have a look at this picture. This shows you the dark area there where the main body of the neuroma exists. You can also see the tail ends of the nerve where it says 1 millimeter. So this one's about 3.5 millimeters, and it is perfectly treatable and doesn't necessarily need surgery, so it's well worth we go there. There is another test though, however, and that's known as a magnetic resonance imaging, short MRI. The drawbacks with the MRI is the fact that you need to go into a tunnel, and this may lead some people to be claustrophobic. But because the operative field, in fact, is the foot and lower limb, a coil is placed around this, and you don't actually go into the whole tube. So it's actually not as bad as it might be if you were having a whole body scan or a head scan, for example. So you don't need to worry about it. It takes a lot longer. It's a lot noisier. But the clarification of tissues is slightly better, and it's preferred by some clinicians over others, but it is a lot more expensive. So what do we see here? We can see the ends of the metatarsals. There's metatarsal 1 on the left-hand side. I can't quite see the 5th because my head's in the way there. We have a little oil pouch circle at the top marking where these arrows are, demonstrating the rather enlarged darkened area of a Morton's neuroma. Around here we can see on the top and the bottom fat, which is present in the lighter colour, but the size of the neuroma can be measured up to a point. Now, I've mentioned ultrasound and I've mentioned MRI now. We can measure these lesions, but they are not 100% accurate. And I know this because when you remove the nerve and send it off to histology, that's the laboratory which looks at the neuroma, a nerve under a microscope, a powerful microscope, so they can actually see exactly the cross-section in the nerve. The measurements are a lot more accurate and they don't always correlate. So in other words, you might see something on MRI or ultrasound. In fact, when you get it to histology, it's actually larger. So I think these tests are vital in order to guide us. Now, most people who suffer from these neuromas may not know how they arose. A lot of people might knock their foot, but for the most part it is footwear driven, I'm afraid to say. And the reason it's footwear driven is because you're compressing these long bones known as metatarsals together, squeezing off the nerves, and in particular it's a nerve that resides between the 3rd and the 4th metatarsal. That's pretty much in majority of cases, but there is a 25% incidence of it being between the 2nd and the 3rd metatarsal. So sometimes you do get 2. Now once you start